My name is Dr. Sandip Kapur. I'm the Chief of Transplant Surgery here at Weill Cornell Medical Center. And my areas of focus are in kidney and pancreas transplantation. Transplantation is a multidisciplinary field. It brings together disciplines from surgery and medicine, and we have an outstanding team here that emulates that. And transplantation is a very young field. It's only been around for about 50 years. Remember, the first successful human kidney transplant was only performed in 1954, and since that time there's really been a virtual explosion of knowledge. And I'm happy to say that our center, I think, is at the forefront of continuing to advance and push the frontiers in transplantation. And we do that by looking at several things. Since transplantation is so complex, it extends beyond just the surgery. But concerning the surgery, we are a leading innovator in minimally invasive surgery for removing the organ from a potential donor. We have probably performed the most number of living donor transplants in the New York area. I think in terms of other frontiers, we have really excelled in our ability to develop new immune protocols which benefit our transplant patients in terms of getting less immunosuppression and having better results with less complications. We are what I consider a high volume center. We did over 240 transplants last year, which places us within the top 5 nationally. This year we're at a pace to do nearly 300 transplants, which would place us in the top 1 or 2 programs across the country. Those types of volumes obviously translate into excellent surgical skills and excellent outcomes, which our results really bear out. Our program is #1 in New York City in terms of volume, and we expect to repeat that again this year. I think one of the unique aspects of our program is that we offer basically every opportunity for transplantation to occur for a patient that comes to our center. This makes us very different than most programs across the United States and in this city. We have programs available for people that come to us with donors that are not compatible with themselves. We have programs where if patients come and for some reason their donor is found not to be compatible, we can pre-treat the recipient to allow the transplant to go forward. We have programs where we can facilitate donor exchanges so that if there's one pair that again are not compatible, but there's a second pair of which the person from that second pair is compatible with the first, and a person in the first pair is compatible with the second, we can initiate an exchange so it becomes a win-win situation for everyone, and again allows for a successful transplant to occur. I think we excel in offering these very advanced medical therapeutic options in terms of we've had a molecular test that's been developed at our site that allows us to follow our patients in a non-invasive way and really adjust their immune therapy in a very specific way that is unique to our center. Those things result in less immunosuppression, less complications for our patients. These are things that we find uniquely here at Cornell. We've developed a unique molecular clinical test here, which has allowed us to really eliminate the use of steroids in our patients, which for a long time has been a real problem in transplantation and creating a lot of very bad side effects that patients would really complain about. But now, since 2001, in fact, nearly 90% of our patients are off steroids after the first 2 or 3 days after their transplant. And that's been a very meaningful advancement for our patients.